Dr. Simona Di Mario from Regional Health Authority, Region Emilia-Romagna, that was heavily affected by the COVID pandemic. So it will be very interesting to hear the experience of this region in ensuring the continuity of essential health services and how the mode and the platforms have changed based on the situation. Thank you, and the floor is yours.
Thank you, Nina. Thank you for inviting me. And okay, let me share the presentation. It's a pleasure to be here with you today. Thank you for having me, and I will try to be quick to save time. This is our experience in Emilia-Romagna. Emilia-Romagna is this region with 4.5 million inhabitants in northeast of Italy. We have an average of 33,000 newborn per year. Almost 40% of the mothers that deliver in Emilia-Romagna were born outside of Italy. Our regional health system is publicly funded.
Can I interrupt you, because we don't see your presentation on the screen?
Oh no. Let me do it again. Okay, yeah, something happened.
But that's okay. You can.
No, but it's okay. It's okay. I hope now.
Take your time. Yes, please.
Yeah. Okay. So, can you see it now? Just let me share the right. Should be okay now, isn't it?
Yes. Yes.
Okay.
Absolutely.
Okay. So, as I told you, 4.5 million inhabitants, 40% of mothers born outside of Italy. And this is our regional health system, so publicly funded. With respect to maternity care, we have 23 maternity hospitals with 9 neonatal intensive care units. And going to the primary care level, we have almost 180 health centers where we provide the care for family planning, perinatal care, youth, adolescents, and immigrant women health. And few data about last year, 52% of pregnancy were assisted in the public health system. Mean number of visits were 7 during pregnancy, including 2 ultrasound checks. And these are some of our characteristics. Usually after vaginal delivery, women are discharged 2 days after the delivery, and after cesarean section, 3 days after cesarean section. Coming to the COVID-19 pandemic, as you say, Nino, we were hit by the pandemic very severely. Nowadays, these are our cases, that is people with positive swab, 26,000, and these are the figure at national level. Number of deaths is 3,700, meaning people who died and was positive, not died because of the positivity, of course. And these are the figure at the national level. Nowadays, we are able to collect between 4,000 and 6,000 nasopharyngeal swab per day. At the beginning, the figure were much smaller. These are data about yesterday, so around 170 people hospitalized in intensive care units, 1,700 hospitalized in other departments, and around 6,000 people in home isolation because of positivity and mild symptoms. As you can see, as our previous colleagues already mentioned it, we have 0 deaths in children from 0 to 19 years old. What we did to sustain our health professionals and the women during this period of the epidemic, we developed some tools. So we have an Italian website for health professionals and the public where we deliver evidence-based information, because we know that in this period, not all information circulating were evidence-based, and this is our website. As you can see in the homepage, we have this special section on COVID-19. And then what we thought was very useful, and we are still keeping on with this, is this weekly video conference with health professionals, both working in the hospital and the primary care, obstetrician, gynecologists, neonatologists, midwives. And that was very important to coordinate activities, to share experience, and especially at the beginning, even emotion, because at the beginning, health professionals were very under pressure because of the pandemic, and to increase consistency and equity in care. During the emergency, you can have differences in different districts, and it's important to have a kind of monitoring and coordination among all the actors, all the professionals, to be sure that they comply with the recommendation. And then we also have, in addition to our national recommendation, also regional one for assisting women in the antenatal, intrapartum, and postpartum care. These are our guidelines that we issued the 22nd of March, and they are continuously updated in our website because evidence come along and we had to update it. And they were based on a rapid review of primary and secondary studies, UK recommendation from the Royal College of Obstetrics and Gynecologists, and the several guidance from WHO that were very useful, and that here are just a list of the one that we cited and that we use it for our recommendation. So the main recommendation, as already told by the other colleagues, are that having a COVID-19 disease is not a reason in itself to perform cesarean section, to recommend absence of a companion during delivery, to recommend mother and infant separation and formula feeding prescription. So this seems very simple and clear recommendation, but they are very, very important. And in the fear of the emergency, not all health professionals were so keen to adhere to this recommendation. At the beginning of the emergency, now we are in the phase 2, but at the beginning of the emergency, we say all not urgent care must be suspended or postponed. But since the beginning, we say that antenatal care cannot be suspended or postponed. So what we did was to do triage to all pregnant women before coming to the visit, for example, in the primary care or in the hospital, assess if they have symptoms. If they have symptoms, we say to wait at home and monitor the clinics and then to reschedule the appointment. Otherwise, proceed as usual and do the ultrasound and check and all this stuff. Some of the activities were guaranteed at distance, so video call, video conference, telephone call, and these were group activity like antenatal courses, psychological support, breastfeeding support. Other activities need to be done in presence, in hospital, in health center, or in the pediatric office, and these were contraception, termination of pregnancy, antenatal care, and all this stuff that you can see here. So some on distance, some on presence were guaranteed even in the emergency phase. Of course, we did an effort to inform the public because, as I told you, information can be complex and contradictory. So we did this poster for the waiting room, for example. Even before the pandemic, we were working to an application, smartphone app for pregnant women, where we provide all the information, where to go, which kind of lab test to perform, where to find peer-to-peer support. And that was supposed to be launched 1 month ago, and then the pandemic came. So we stopped the launch of the application. We changed some of the content to update it with the COVID information, and it was just launched 1 week ago. So we don't know the impact, but we know that was downloaded, and we have some positive feedback from the women. And it's nice because it's called Not Alone. In Italian, it's Non da sola. And I think in this time of the pandemic, is even more important not to be alone and not to leave the woman alone. These are the numbers of our women. So 120 pregnant women were positive, 60 deliveries from women positive with 20 cesarean section performed. None of the newborn was positive, and mostly of them were breastfed. We have 15 infants that were infected thereafter. So no vertical transmission, but horizontal transmission within the family, maybe when they were 1 month, 5 months of age. None of them developed a severe disease. Most of the pregnant women that were positive were in at-home treatment with only mild symptoms. I think less than 5 were admitted in hospital for respiratory support, none of them with invasive respiratory support. So coming to the conclusion, we face some problems that we think are in common with other countries. At the beginning of the pandemic, personal protective equipment were insufficient. Nowadays it's much better. At the beginning, the infrastructure and the personnel to perform the nasopharyngeal swab also were insufficient. So we started only testing symptomatic cases. It's slightly changing now because it's increasing our local capacity for a lab test. And then the big problem of the fake news, these contradictory messages from the social media, especially to the public, I was mentioning before. what we are going to do for the phase 2, gradual increase of activities, both in hospital and health center, reopening of productive activities. This means also that we have to think about needs for infant and child care to provide this help, support the family that had to come back to work, extending swab testing to all pregnant women, even the asymptomatic, as we hear also from the German colleague, and extend serological study on group of population and professional. These are our key messages that we think we can share. At the beginning, our main message to the community was stay at home. Now we are in the phase 2. What we have to really be clear of is keep the distance and wash your hands message. The best is the enemy of the good. Just to say, at the beginning, we thought that all the swab tests need to go to a central laboratory in Rome because they have the perfect technology. But this is unsustainable. So we rapidly increase our local lab capacity. And then it's very important in emergency to protect the right of the woman to have a positive pregnant experience, as always WHO reminds us, and for the baby to have a positive pregnancy experience. And this is important because at the time of emergency, health professionals fear the danger. And maybe this can be the first rights to be threatened by the emergency. And then organizational capacity is as important as resource availability. We distributed PPE and the nasal swab in the same amount in different districts, but then in some districts it worked well, in some districts it didn't work well because of managerial capacity and organizational capacity. And last, a good balance between hospital care and primary care, because at the beginning of the epidemic, everybody's just focused on hospital and intensive care unit, while now we really need to strengthen our primary care to be able to keep things in the right way. Thank you, I finish.